Lesion of the sciatic nerve and its branches. The sciatic nerve is the largest nerve in the body. The sciatic nerve starts from the nerve roots in the lower back, and the nerve roots join each other to form the sciatic nerve. It arises from L4, L5, S1, S2, and S3. It has two main components, the tibial nerve and the common peroneal nerve. The sciatic nerve runs through the buttock and the lower limb. The level of the division of the nerve is variable, but it usually occurs at the middle or the lower third of the thigh. In about 10% of the patients, the division of the sciatic nerve can occur at the greater sciatic foramen. Lumbosacral plexus injury can occur from a pelvic fracture with displacement of the sacroiliac joint. As the nerve enters the pelvis through the greater sciatic notch, the nerve passes underneath the piriformis muscle. That is the normal relationship between the sciatic nerve and the piriformis. There are some uncommon variations in the relationship between the sciatic nerve and the piriformis. However, the normal relationship with the sciatic nerve is the sciatic nerve passes underneath or anterior to the piriformis muscle. Entrapment of the sciatic nerve at the piriformis level is called piriformis syndrome. So what is piriformis syndrome? It is a condition of leg pain or sciatica due to compression of the sciatic nerve at the hip. So the sciatic nerve is irritated, not from a spine problem, but from problems related to and associated with the piriformis muscle. Clearly, the piriformis syndrome can be confused with sciatica and lower back pain. There are several tests commonly used to diagnose piriformis syndrome. The Lasug maneuver, which attests stretching in the nerve, and the Fair test, which is stretching the piriformis muscle itself. The Lasug's maneuver, reproduction of the pain by the hip being flexed to 90 degrees and the knee extended. The test can also be done with the patient on the side. The other test, the Fair test. Fair test is not Faber test. Faber test is used to diagnose sacroiliac joint problems. Fair test is a piriformis syndrome test. So we're going to assess if stretching of the muscle is causing pressure on the sciatic nerve and patient symptoms. How do you do the stretching of the piriformis muscle? You do that by flexing, adducting, and internally rotating the hip. This maneuver will stretch the piriformis muscle and will cause symptoms because it will compress the sciatic nerve. It will put tension on the piriformis muscle and it will reproduce the symptoms of the patient. Also, during these maneuvers or these tests, when the examiner adds pressure on the posterior part of the buttock, the patient will complain of severe tenderness and pain. Piriformis syndrome is a diagnosis of exclusion. If the patient has symptoms of sciatica, then there must be an MRI of the spine that is negative for a disc herniation to prove that the symptoms are not coming from a possible disc problem. From the gluteal region, where the sciatic nerve is covered by the gluteus maximus, the nerve runs downwards to the back of the thigh. The sciatic nerve lies between the greater trochanter and the ischium, and as it descends anterior to the piriformis muscle, it crosses posterior to the tendon of the gemelli muscles, the obturator internus, and the quadratus femoris muscle. So the sciatic nerve is anterior to the piriformis, but posterior to the obturator internus. The sciatic nerve is close to the acetabulum. That's why it can be injured easily as the hip dislocates. The common peroneal division of the sciatic nerve is the one that most commonly injured during dislocation or fracture dislocation of the hip. Injury to the sciatic nerve will cause foot drop. The sciatic nerve can be injured due to posterior surgical approach or errors in placement of the retractors, or because of lengthening of the femur, or from total hip acetabular screw placement. During posterior approach of the hip, if you need traction on the lower extremity, please keep the knee flexed and the hip extended during traction to avoid injury to the sciatic nerve. This is particularly important during posterior approaches to the hip and during posterior exposure and fixation of acetabular fractures.